Hi, how's it going? I'm Laurie Nunez, and this is my last project for Sports Medicine 3, and I did it on the triangular fibrocartilage complex, which is called the TFCC. So what is a TFCC? So the TFCC is located on your anterior side of the wrist, and what it does, it supports small carpal bones and stabilizes the ulnar radius when you grip something or when your wrist rotates. And any TFCC injury can cause chronic pain. So what causes TFCC injuries? A thing called the foosh, which stands for falling on outstretched hand. And basically, well, when you just fall on your wrist, it's going to probably fuck it up. And then hyperflexion, wrist backwards. So it's common in like power cleaning or any sort of wrist hyperflexion of the wrist or wrist fractures. Kinds of TFCC injuries. So you can either get it from athletics or you can get it from aging, which would cause a worn out TFCC just from being worn out. And this shows all the TFCC class injuries you can get, starting from class 0 to class 5, and basically going from an acute injury to a chronic injury. Here's some showcase of an MRI where the TFCC is located and an open surgery of a TFCC tear repair. Symptoms you can get from a TFCC is TCC tear, is stiffness, weakness, limited range of motion, swelling, and clicking and popping and pain. And the population that's at risk, elderly people due to a worn out TFCC ligament, and athletes that play stick sports are mostly at risk due because they use their wrists more than other sports. And of course, everyone can get this either from falling on an outstretched hand, but it's most common in stick sports. Now, this is not recommended to do at home because you're not doing rehab, and eventually it's longer for the healing process to take. But basically, if you're not going to do a surgical, or if you don't need a surgical TFCC repair and you don't want to do rehab, basically it's going to take 12 weeks to heal without rehab. And of course, you're going to want to take anti-inflammatories to take down the swelling and put your wrist in the cast. Now, these are the prehab choices you can do when you do rehab. And like any other rehab program, our goal is to reduce the swelling, pain and swelling, improve range of motion, improve strength, and with the rehab program, you should be healed from 4 to 6 weeks if it's a non-surgical TFCC tear. Now, the surgical option is another one. There is 2 types of TFCC surgicals. One of them is an open TFCC surgery, which they they open up your wrist and fix the ligament from there, or they put arthroscopic assisted outside a TFCC repair, which they make small incisions around the wrist and fix it from there. And it takes 3 months to heal with a rehab program after this. And this is the rehab program, similar to the prehab, except you have to be immobilized for the first 6 weeks after surgery. And lasting effects, if you do the rehab program right, that your doctors or athletic trainers give you, you shouldn't have any problem with it, and you should be fine. I mean, there could be popping, but everyone has fallen before and landed on their hands, so everyone has popping and clicking in their wrist. Ways to prevent it: if you're playing sports, athletic tape is a good one. Learning a falling technique and strengthening the muscles around the wrist. And is there any questions? Feel free to ask.